Good afternoon, everyone. I am Dr. Utkarsha Jaiswal, the Assistant Editor with the Dental Practice magazine, and I am here at the Osstem meeting in New Delhi with our esteemed speaker, Dr. Nigam. Good afternoon,
Good
sir.
afternoon.
It's a pleasure meeting you today, and I'd like to ask you a few questions.
Sure.
So, first of all, where do you see the implant industry headed in the next 5 to 10 years?
Well, that's a beautiful question. So, implant in next 10 to 15 years, it is going to go way ahead with the digital technologies advancing in a super speed, with the surface technologies coming into the peak level, and there are a lot of advantages technically and the clinical wise that is enhancing the entire concept very nicely. So it is very promising science, and implant per se they have completed almost 50 years of its existence now, and it is highly promising for next another 50 years for the faster rehabilitation of edentulous patients.
Wonderful, sir. So, what are the top reasons why dentists should attend an event like this?
They must attend all the scientific events to upgrade themselves. That is the priority. And science is ever changing, as we see, because there are a lot of new innovations in the market. There are a lot of new technology has come up. There is a lot of digital innovation is coming up so fast. So one has to learn, unlearn, and relearn the entire concept. So that is one thing we need to do it.
And sir, one question for you. How does the super hydrophilic CA implant surface enhance the predictability of immediate loading? And what are some of the clinical challenges associated with this approach?
Yes, so the superhydrophilic implant surface, why it was required? Because the regular implant, after a certain time after the manufacturing, it creates the hydrocarbon deposition on the surface, right? So these hydrocarbon surface makes the implant very hydrophobic. So the blood takes more time to attach to the implant surface. So if we change the surface and modified the surface to a better hydrophilic surface, then there is a faster osseointegration. The treatment time is reduced a lot. There is more patient acceptance regarding the faster treatment, and the science has already proven with this change in the surface that it is more predictable if we do immediate implant placement with new surfaces. So that is one of the great innovation by the Osstem, and it has been researched for last 1.5 decade on these surface changes, and we have now two surfaces from the Osstem side. One is Osstem CA surface, and one is NH surface. And in future, we will have another super hydrophilic surface called SOI in I think 2026. We will be introducing to India. So it's a very promising surface. We are going to get it.
And any clinical challenges associated with this
So the
approach?
clinical challenges occurs or we come across in day-to-day practice when we are doing the immediate implant placement and restorations, immediate rehabilitation. The entire world is going too fast. Everybody wants to have results in on a single day, and people don't want to stay without teeth even in a single tray because smile designing people are going out socializing, so they want to have a smile, beautiful smile on the day one when we remove the tooth, and they want to replace it with the implants. So we require these kind of surface modifications, surface technologies, where we can comfortably and confidently we can do that procedures. So these challenges will overcome with the new surfaces.
Great, sir. Thank you so
Thank you
much.
so
This
much.
was very insightful, and thank you so much for your
Thank
time.
you so much.
Thanks a
Thank you.
lot.